Good morning, everyone. Welcome to Helping Dr. Gupta with Physical so we can be super efficient. What I've done is tried to make the process easier because doing physicals is a very complex process, and now that we're a medical home, we're trying to become better at it. And also, some of these tasks could be completed even on the day the patient agrees to do the physical. I'm going to go over the checklist for you guys and show you how to help me be organized and get these done in a reasonable amount of time. So let's talk about how we're going to implement this protocol. What we're going to do is try to make it a process that we can easily access, and we can also break up into parts. So we'll have the common handouts that we use for physical right in the hallway on the wooden table. That would be things like self-breast exam, self-testicular exam, calcium education, the questionnaires and handouts for depression, anxiety, bipolar. And then we also talked about perhaps one for headache because it's so complicated. Another one that we haven't obtained yet but that they like us to discuss is advanced directive. So those would be in the hallway. And then this is a new sheet here, staff physical exam checklist. We're going to have this available up front, but also in each room in brightly colored folders so that it's easy for us to, when we say, well, you've done your part one, now we're going to set you up for your actual examination, which is called part two. We would grab one of these sheets and attach it to the top of the tracker. Now, let me show you what's in there. It's slightly different for men, women, and children. The first one here, ROS, is review of systems. Then we talk about some lab work, some testing, cancer screening, and mental health, and then diabetic interventions. So let's talk about review of systems. I'm going to show you a sheet. Some of you may have seen this before. What it is a list you can give to the patient. Unfortunately, some of them, if they couldn't read it, you may have to read it to them. But it's to quickly assess for hidden problems that may be going on. For example, sometimes patients are very nonspecific, and this right here, if someone says they're suddenly awakening from sleep with shortness of breath, they may be having worsening of congestive heart failure. If they say they may be doing it with laying down, that could be COPD or CHF. And if they say it's more with activity, I might be looking into whether they need a stress test. So this one is thorough enough but short enough that it's useful. And review of systems is supposed to be reviewed yearly. So what they would do is mark it off, and then you guys would circle those. And then when you're on your main sheet here, you would circle abnormal and just list the most important topics so that I would know to look at that. Here we're marking UA is to check the health of the kidney. If there's extra protein, that makes you wonder if there's kidney disease, especially if there's no infection going on. So everyone who has reason for blockages such as smoking, hypertension, diabetics, anyone who has stress on the kidneys or decreased kidney function, we would want a yearly UA if they have not already had one. This one, the urine drug screen, you guys all know. We would just say, oh, time to get your yearly urine. And then here you would make a note if there's something I need to pay attention to. Then here, a lot of times we've already done the EKG or PFT, but the question is, have we charted it on the tracker, and is it abnormal? So here we could put PFT okay, EKG decline, or PFT okay, EKG normal. We could put PFT abnormal, EKG abnormal. Then and just circle it, then I'll know to pay more attention to those. And we can have this form on top, and on the top of the chart we can have anything pertaining to this turned sideways. Everything should also be hole punched so that when we're done we can file these away quickly. PSA is optional for guys who want to know about it, or their regular labs. So if there need to be done, they'd be done. And then here, if there's like a very high potassium or creatinine, you can make a note right here. Colon cancer, you're going to note whether they decline, is it due later, or that you've given them an order form. Remember to also make a copy and let Greg know if it needs a referral. Depression, for folks who have depression or significant anxiety or bipolar, we want to fill the appropriate questionnaire and just see if it's any better. So for example, we would check their Beck questionnaire for depression and put the score here and say normal, mild, moderate, severe. This one, a lot of times people didn't realize when I'm doing a guy's physical, I'm going to need the gloves, I'm going to need something, a towel with the gel on it for them. And I usually give them a tissue afterwards. So I need that in the room. Diabetic foot is the form that we have for diabetic foot exam. So if it's an elderly person and they still have their socks on, for example, having that out and ready is helpful. This is the kind of thing that if we have time to complete it before the physical, like the visit that we tell them that they need a physical, if we have time to complete the questionnaire before they come for that next physical, we can clip it to this page, and that way we can get ahead of the game for when they actually come for their physical. Now for women, it's very similar, just a couple extra points. We talked about the review of systems, labs, and the urine. Down when we get here to PAP, I would need to know if they need a PAP. For example, do they still have their uterus? When is the last period? That has to be written on the lab form. The tubes all need to be labeled with their date of birth, and if they're getting just a PAP, or if they wish to get infection testing, that's the vag culture and the GC chlamydia culture. Is the mammogram order, and here if they don't want it, you could say declines or put not needed. For the mammogram order, again, whether they decline, you already gave them an order, or if it's due later, those do not need referrals. Same thing about the EKG or PFT, but again, charting the result on the tracker. And the diabetic foot, the same thing. Now for children, what we want to do is make sure you've taken the appropriate vitals. Babies up to, I think, a year and a half, we need their head circumference, in addition to height and weight. Then there should be the same growth chart they've used before in the chart. You'd want to plot that reading. If you're not sure, you can ask for help. But note here if there's any abnormalities. Kids often do not have a problem list, but they should, and we should include things like divorce in the family, having trouble sleeping, any concerns that you notice, difficulty in school, and then we're very good at addressing those. So if we start addressing those, then we can start making a to-do list for that child. The physical exam form has questions that are for education and to assess their diet and their development. So you want to make sure you have the form and you've talked over those questions with the parent and put their concerns on there. If they want, we do have the vaccine sheets for education. And fill out means fill out the physical form. When we do MICR, what we want to do is make a copy of what we've done for Melissa. We also need the brand name of what we gave, because they're billed differently according to brand name. We don't need the lot number because those are to be given to us. Those are recorded when we first receive the vaccine, but that does need to be recorded in the chart and on the sign-off sheet at the nursing station. And then that router, just to be safe, because we have to double check what was billed, if you copy it and make sure the vaccine is marked clearly, it's actually easier to have Melissa or Dr. Gupta bill those because they are so complex. And that will really help us with the improvement of physicals. Again, we can pull this sheet when we discuss step 2 with the patient. We can grab a pink slip and circle it and let them know this is for the actual physical, and that we, if at all possible, We try to do it separate from the regular visit. And then any of these that we can address when we first tell them that, if you can address the review systems, if you can get them to start the diabetic foot, if they can fill out their BEC when they come back for the actual physical, it's a little bit less work for you and for us. Thank you so much for all your help. Sorry this is so long. Have a great day.